Welcome to all those who've already signed up. We're just going to give people a couple of minutes just to log into Zoom. We've been having some fun logging into Zoom this morning, so just want to give people a moment. And we'll kick off about 2 minutes past. And just if anyone has any Q&A throughout the session, please do pop it in the Q&A section of Zoom on the bottom panel. And we'll have a Q&A session at the end of the presentations. Okay, thanks so much for joining us this afternoon for our webinar focusing on securing healthy homes locally. And it's focusing on a guide that we launched earlier this year, tied to our campaign for healthy homes. You can move to the next slide, please. So this hour-long webinar will just do a quick round of introductions and then we'll be giving some presentations of just an overview of the guide before kicking off with some of the detailed examples within the guide from Jennifer Dudley at BRE, Emily O'Brien and Nathan Haffenden from Lewes District Council, and Katia Stiller from Tibbalds, and we'll have Q&A at the end. For anyone who has any questions or thoughts during the presentations, just pop them in the Q&A section of the Zoom feature. Thanks, Clement. So for those of you who haven't worked with us in the past, the Town and Country Planning Association, we've hit our 125-year anniversary this year. We've long been working to promote places and communities for everyone to thrive, working with local authorities as well as national governments to lobby about healthy place making. Next slide, please. So this piece of work and the guide is part of our campaign for healthy homes, which has been running for about 4 years now, and it has a sort of national strand to it where we've been lobbying the government for a healthy homes bill, and this is a part of the local strand of work, working with local authorities and partners to promote the healthy homes principles. And the campaign has been funded by the Nationwide Foundation. Thanks, Clement. So myself, I manage the campaign for healthy homes with Sally Roscoe, and we'll just give you a quick overview about the guide now. So it's divided into 5 sections. Firstly, sort of outlining why we need healthy homes in the first place, and the bulk of the guide is focused on implementation approaches for local authorities, with a short section of thinking about the types of homes created through permitted development, and then there's a resources section at the end of the guide. Thanks. So fundamental to the campaign for healthy homes and within this guide is this understanding that as we have growing knowledge about the relationship between the built environment and health outcomes, unfortunately, we're still delivering homes that are not decent for people to live in. There's some 4 million homes in the UK that fail to meet the decent home standard in one criteria or another. We also know that people living in poor quality homes are twice as likely to have poor health outcomes. And this has significant costs, not only to the NHS in terms of treating people who are unwell as a result of living in poor housing, but also wider costs of society through people not being able to work due to ill health. And we know that, unfortunately, the sort of last 10 years of deregulation of housing rules and policies have resulted in poor health outcomes for many people. Thanks. So this is a slide just showing some of the proportion of homes that are failing to meet the decent home standard by tenure. We know that private rental sector is the worst performing on the decent home standard, but also owner occupied homes as well are quite poor. If you could move to the next slide, Clement. And this is showing that kind of regional distribution of homes that are failing on the decent home standard. And so actually it's quite a lot of variation across England in terms of those homes that fail at least one category 1 hazard from the decent home standard. Thanks, Clement. I think it's important that we reflect not just on these sort of high-level statistics, but we keep going back to what's the experience of people living in poor quality housing. And unfortunately, we've seen both in rural and in urban contexts, poor quality homes being built now in the 21st century, both within the interior of those homes from issues around damp and poor indoor air quality, as well as to the exterior in terms of poor provision of space and access to amenities, play space for young people. Next slide, please, come. This is some images from permitted development homes from poor quality interiors, where the image on the left is a building in Harlow, which was the bedroom was for 3 young girls. It was on the ground floor, had lots of damp all over the room. Had just recently been painted when we saw it, but unfortunately it was very, very crowded, poor noise protection from the neighbours, and very limited daylight provision. This the image on the right was from a property which was had to be evacuated entirely because of fire safety concerns. Thanks, Camille. So at the heart of the Campaign for Healthy Homes is 12 Healthy Homes principles. The idea being that the current sort of framework and regulations around managing housing quality is very piecemeal, it's confusing, it's messy. We're calling for a very comprehensive approach to thinking about how we deal with housing quality and having a consistent way of doing that. And that benefits not just planners, but also developers in terms of understanding what we, not just the minimum requirements, but also promoting better health outcomes for everyone. Thanks, Clement. So in section 3 of the guide, we could talk about different ways, particularly from a sort of planning point of view, that local authorities could integrate those healthy homes principles. And we've listed a number of examples, and Sally is going to just talk through 1 or 2 examples before we get into the detailed examples from our panel. Thanks, Sally.
Thanks, Rosalie. So there are several pathways towards implementation that we explored throughout the guide, and here are just some of those case studies. So here we have an example is the Development Quality Charter prepared for the Hertfordshire Growth Board, which encourages developers and councils to voluntarily sign up to achieve more ambitious design and sustainability standards. The charter aims for you to go beyond building regulations in the promotion of good quality housing and wider development, and states that developers should identify sustainability standard, such as BRE's Home Quality Mark, that exceeds current minimum building regulations as part of the planning application, and then use an industry recognized process to demonstrate compliance with that standard upon development. And the aims of the charter are in line with the core messaging of the Healthy Homes campaign to ensure that development promotes health and well-being. And then on the next slide, we have more specific examples. So here is some local plan policy, and they can local plans can embed the Healthy Homes principles, whether directly or through policy that encompasses many of these principles, such as those shown on the slide. They are from the policies from the London Borough of Havering and Plymouth and Southwest Devon's local plan. They are included in the guide, and they reference various healthy homes principles as well as other aspects of healthy placemaking. And then our next example is about specific healthy homes principles. So on a more detailed scale, local plan policies can focus on a specific healthy homes principle. For example, what we have here is the City of Bristol has adopted a comprehensive suite of climate-based policies that cut across carbon emissions reduction, and as well as climate adaptation and resilience. So that covers those healthy homes principles. And a similar policy can be applied for other healthy homes principles, all of which can work together to promote healthy development. And then back to you, Rosalie, on the next slide.
Thanks, Sally. Yes, so as we mentioned earlier, a big emphasis for the campaign was trying to address housing produced under permitted development rights. We know that some 100,000 homes have been produced between 2015 and 2023. And the kind of focus of this was very much about delivering quite more homes. But we've been very concerned about the quality of those homes and looking at ways that authorities can help promote better quality outcomes, even when the full planning application process has not been applied. This slide just sort of talks about some of the issues we've identified, including how through not going through the formal planning process, developers can avoid things like Section 106 contributions towards affordable housing and amenities, but also there's sort of loopholes in terms of regulations when you have a material change of use to residential use around overheating, around structural safety, which we're very concerned about. And furthermore, that residents often for these sorts of conversions, we see people using these homes for temporary accommodation. So they have licenses to occupy rather than tenancy agreements, so it gives them less secure provisions. And on the next slide, to give some examples in the guide of sort of policy responses that different authorities have been using in relation to the quality of permitted development rights. We know that there's very limited levers, but they include Article 4 directions, prior approval conditions, Section 257 of the Housing Act on houses of multiple occupation, and some examples of local plan policies that talk about design quality expectations through permitted development. So I'm now going to introduce some of the case study examples that we've included in the guide, as we think they're really exemplars in ways to embed the Healthy Homes Principles. So I'd like to introduce Jennifer Dudley from the Building Research Establishment. Thanks, Jennifer.
Thank you, Rosalie. My name's Jen Dudley. I am our product manager for residential housing at BRE, and I'm delighted to be here today to talk to you about our home quality mark, also known as HQM. Next slide, please. So what I'd like to do this afternoon is to spend a couple of minutes just introducing the home quality mark for those who are perhaps unfamiliar with it, and then would like to touch on a couple of fantastic case studies that we've been working on with some of our stakeholders and have actually recently published about them using HQM and embedding HQM into their build programs. Next slide, please. So by way of a quick introduction for those who aren't familiar with HQM, it forms part of our BREEAM suite of sustainable certification methods, but HQM is specifically tailored for the UK new build residential market. For those familiar with BREEAM, you'll be aware of kind of these principles that are embedded in BREEAM, but HQM adopts these same principles, and I wanted to just run through these to make sure everyone was aware. So we look at sustainability holistically. Essentially, we have a scheme that offers almost a menu approach of ways that you can demonstrate that you are embedding sustainable credentials within your developments. And in some cases, we will require particular focus or achievement against particular criteria to achieve higher levels. As with BREEAM, we offer third-party certification. So there are a pool of over 100 HQM assessors who are able to go out and assess those homes. And once they've created their report, they will submit that to BRE for quality assurance. And then importantly, HQM, like BREEAM, only recognises for performance that has gone above the regulatory minimum. So think of any achievement against HQM as Michelin star, like any achievement is great and should be celebrated. And because of its connection with the family of BREEAM tools, HQM also benefits from being built upon 30 years of sustainable certification science. What I want to demonstrate over the next couple of slides is perhaps our response in the evolution of HQM in growing trends that we are seeing over the couple of years with regards to sustainability and health and well-being and the synergies that lie therein. So we certainly saw an increase in attention and focus on health and well-being practices and criteria during the pandemic. And perhaps since then, with homes specifically, we spend a lot of time in buildings, but perhaps since the pandemic, more people might be spending more time in their home. I certainly am working from home. But what we are also seeing, as I think Rosalie was mentioning earlier, is kind of increased awareness of the costs of not implementing or embedding these principles in our homes and the designs of them. So the increasing costs, be that to the NHS or broader society, of not having healthy homes or homes that meet the needs of the occupants that are inhabiting them. So briefly, what goes into HQM? So this is a snapshot of the scheme coverage, if you like. What HQM does is it will look at aspects related to the surroundings of the home itself, and then also the processes and practices that go into delivering that home. And what I'm hoping to demonstrate here is that there are some specific criteria that perhaps more intrinsically relate to and align with health and well-being practices, but actually what we see across the whole of this suite is that a lot of these do in some way, shape or form affect an occupier's well-being and health, and HQM tries to draw that out. So touching on a couple of the specifics in the surrounding section, for example, HQM will credit provision of recreational space and proximity to local amenities. It also looks at and assesses public and sustainable transport options, as well as flood risk and security measures as well. Looking specifically at the home level, again, some specifics that look more predominantly at the health and well-being elements, assessing daylighting, sound installation, ventilation, energy and carbon performance, and HQM also looks at access and space. And just to reiterate that any reward that HQM offers here is about or where a home has demonstrated that they've gone above and beyond the regulatory requirements there. So moving on to the next slide, please. So I've spoken about what goes into HQM, but what comes out of it. So every home gets its own HQM certificate, and on that, they will achieve a rating out of 5 stars, looking across that menu of options or ways in which they could demonstrate compliance beyond regulatory minimums. But what we did in HQM was also introduce what we call indicators, which look at providing a score specifically against the triple bottom line elements. And you can see as part of that, one of the scores that we offer is a score against my well-being. And what that does is it looks specifically at the way that that home has achieved that overall star rating and the credits that it sought that specifically relate to the well-being and health of the occupants. So that's what comes out of an HQM assessment. For anybody who wants to know more about HQM, I'm happy to talk about it at length offline with anyone. So please reach out if you want more information about how the scheme works. But if I move on to the next slide, please. I wanted to spend a bit of time now talking about 2 HQM case studies that we have recently released. The first is with Dandara Living. They are using HQM predominantly to help demonstrate their ESG objectives and ambitions. But the one that I wanted to focus on today was the City of London Corporation. They have embedded HQM into their housing design guide and are currently actively applying HQM to 2 of their projects, Sindon Hill Estate and York Way Estate, where they're delivering over 200 new homes for social rent. I want to just draw out a couple of the key reasons why City of London Corporation decided to apply HQM and chose HQM. The first was with regard to the holistic approach to sustainability that I've already mentioned, and in particular, the aspects that positively impact health and well-being were really key in the city's corporation's decision to implement HQM. In part because this connected really well with their corporate objectives, which was reinforcing their dedication to high quality social housing that benefits the residents themselves, but also the community and the broader environment. And another big reason why they chose to adopt HQM was its ability to provide the robust and comprehensive audit trail and verified outcomes. So HQM can be applied across the UK, which provides a level of comparability across different sites, but also just at a home level as well. And a real key benefit that City of London saw with HQM was that it introduced really clear and measurable objectives through the design, construction, and then flowing into that post-occupancy phase as well. That's all from me. It's a really whistle-stop tour. What I'll do is I'll drop some links to the case studies into the chat so you can read a little bit more at your leisure. And I'm more than happy, like I say, to have further conversations with people who might like to hear more as well. And I guess the only other thing to mention is talking specifically about the home quality mark today, but also mindful of other ways in which BRE more broadly might be able to help local government around things like stock model and our cost of poor housing report as well, which I'll drop into the chat as well. But thank you so much for your time. Back to you, Rosalie.
Thanks, Jennifer. It's really, really helpful. And I should have said at the beginning, but one of the reasons why we particularly sort of picked up on the home quality mark was that it addresses all of the healthy homes principles and has a slight, and even goes into further detail, and the fact that it's working in affordable housing schemes. So we're really excited about that. Just another comment to say, if you've got any questions or that you'd like to raise, just pop them in the Q&A section of the Zoom, and we'll come to those at the end of the session. If we could move to the next slide. Thanks. So our next speakers are Emily O'Brien and Nathan Haffenden from Lewes District Council. Emily, would you like to introduce yourself? Thanks.
Hello there. Hiya. I'm Emily O'Brien. I'm the Cabinet Member for Climate, Nature and Food Systems at Lewes District Council. And I was going to start by setting the scene as a kind of councillor, and then I'm going to hand over to Nathan to tell you about the real stuff at Lewes District Council. Thank you. So as I said, I'm currently holding the lead member for sustainability. However, if we could have the next slide, please. I was also previously the cabinet lead for planning and that's when we came in as a new administration in May 2019. So we came in as a new administration and we had 2 areas that were really key to where we wanted to deliver. So the first one is the climate crisis. We passed a climate emergency and took very seriously that that we needed to put that at the front and centre of everything we do. But we also wanted to address our local housing crisis, and particularly the shortage of affordable housing we have locally. Lewes District is on the south coast, and we have quite expensive housing. So we were committed to a new council house building programme without there being a kind of lot of history of council house building in our area. And I think what attracted me to bring a motion to the council where we would seek to embed the healthy homes principles, there were a number of things that came together. Obviously, we wanted to look at those things holistically. So we're looking at both of those things. We wanted to deliver together on the housing crisis and the climate crisis. We're also really aware of the health crisis as well, and indeed the mental health crisis. And as others have said, COVID really kind of highlighted the impact on some of that, of where we live. And I was concerned about the deregulation. I think I first came to this through permitted development, but we'd also just had Grenfell as well, not that long before. And there was a sense of kind of build at any cost. I think we'd had real issues locally around the kind of very high local housing targets and the impact that was having. So I really liked the principles, the healthy home principles, because they look across those related issues. They bring in climate and sustainability, but also healthy and safe housing. And I also really like them because they're very aspirational. They are, aren't they? We're trying to do best, but they're also quite pragmatic. They're principles, and so it's about embedding the approach. We're not, occasionally you can get kind of tied in knots if it's a set of standards across everything, but there is the flexibility there to make those difficult choices. And the third thing that I really liked about, and this is the thing I like most, is that it's a really positive framing. So it's all about a vision of what housing can be. It's not just about what you can't or mustn't do. So we passed a motion which was based on the kind of template TCPA one that had been developed around healthy homes, but we adapted our own, and there's a copy of the one we did in the guidance, which the TCPA have produced. The motion was really useful. We could have just, we were in control of the council. We could have just implemented the approach and said, that's what we're going to do. But it felt really important to bring it to the whole council. So it was discussed and aired, and some of those kind of almost not conflict, but, areas in which addressing all those different areas at the same time can bring up. And it also allowed us to support the national campaign as well, which later on this year, we've also signed up to the TCPA's pledge on healthy homes as well as the council. But the most important thing is it's kind of given us a framework for doing stuff, not just talking about it. So obviously just passing a motion doesn't change anything, but we've got some fantastic officers who've really taken this forward. So I'm going to hand over now to Nathan Haffenden, who's one of those fantastic officers, to tell us about how we took this forward through both our planning and our housing policy.
Lovely. Thank you, Emily. Afternoon, everybody. Good to see you. So I'm Nathan Haffenden. I'm the Assistant Director for Property and Development for Lewes District Council. And I'll take you through some of the more tangible areas that we've been able to really embed and implement the healthy homes. So as Emily articulated very well, you've got a really strong sense from the administration, and when the motion was approved, cross-party buy-in to really put this in motion. So the couple of ways that we've been able to do that so far, I think it's fair to say that we continue to try to embed and root this in the council's culture. So we continue to strive to make sure that those healthy homes and place principles are met for our residents. I'll talk a little bit about some of the ways that we've done that through our own development. What we started doing was looking at our own policies, processes and procedures. So a real end-to-end review over where we could embed and take advantage of changes within policy and procedure already in progress. So as a council going through our local plan review, it's a great opportunity to make sure that the healthy homes principles that we are looking to deliver are fully incorporated throughout. And that's very much intrinsic in the discussions that are happening in terms of that plan development at the moment. We've also then been able to look at implementing it within the delivery of our own homes. So if you take apologies, I'm in the town hall, and if you can hear a ringing, I can't avoid that, sorry. So the local plan looking at the wider housing delivery across the district, but as the previous slides said, Lewes District Council, certainly since 2019, have been one of few councils who have really pushed to build our own housing, something that we feel really strongly about, very much affordable social housing. And we have wanted to create quality homes in the right places and homes that are affordable for people to live in. So again, the healthy homes principles just made absolute sense. sense. And so we've been looking at ways of integrating that within our own development policies and codes, which I'll come on to in a minute. But overall, strategically, it's very clear how the healthy homes sit within our corporate plans. So again, if any other councils want to see how we've been able to do that, corporate plans are publicly available, and of course we can share links. We've been able to be very clear about how we intend to deliver those principles, both within our own homes and homes being built by others elsewhere in the district. If we move on to the next slide. This brings us on to very, very recent where we are today, a decision that Lewes District Council's Cabinet, including Emily, are going to be deciding on this week. So building upon the healthy homes principles, Lewes District Council have decided to encapsulate that within its own document that we have titled our New Homes Principles. So this is a document that Lewes District Council will approve, hopefully, and publish. It's been developed cross-party. It's also been developed in conjunction with our recognised tenants association within our social housing stock. And the principles very much do what the healthy homes principles are setting out to achieve. As you can see there, we've separated ours into 5 core principles around places, placemaking, quality, and of course healthy homes, social value, environmental impact, and recognising the diversity, particularly in our district, where there's quite a different geography and socioeconomic makeup. So these principles will be a guiding tool for when we deliver our own homes, and any new development that the council builds hereafter would be built in accordance with these principles. So as I say, they're due to be approved this week. This is a very early sighting of what will be in there, but once they are approved, they will be made publicly available. And as you can see, again, we've very much talked about how healthy homes forms an intrinsic part of what we do. So we will continue to work on that basis. We're also actively having conversations around the house quality mark that you just heard from Jen Dudley. Again, really linking in with what we're doing, and we're really keen to make sure that we continue to strive ahead, as you said, Emily, to be ambitious and aspirational, as well as really practical in what we deliver for local people. Emily, unless you had anything else to add, happy to hand over to Rosalie again.
Thank you both. That was really great, and really great to sort of have a first look at your new policy there, which is really exciting. So I hope there's a positive vote in the Cabinet this week. So our next speaker is Katya Stilia, Director of Planning and Urban Design at Tibbalds Urban Design Practice. Thanks, Katya.
Hello, thank you, Rosalie. Hello, everyone. Yeah, I'm Katya Stille from Tibbalds, and I mean, we're very pleased that to be here, and also that there's so much interest in healthy homes and healthy environments. As a company, we have signed up to the Healthy Homes Pledge as well, because we really want to support that, and I think it's a brilliant work that the TCPA has done there. I think I'm going to kind of go a little bit wider in some of the projects, and particularly the first one kind of looks very much also at the context in which those healthy homes sit. Because, I mean, to live healthy lives, a lot of the elements, for example, you know, walking, cycling, and so on is a big part of that. And those decisions are being actually taken probably, you know, in your hallway, in your kitchen, of whether you're going to take the bike or walk or take the car. So there is a really close connection to the surrounding, the immediate surrounding outside of your home, the doorstep, the storage, the hallway. You know, whether your bike is kind of located at the back of your house or at the front, whether you have space to kind of have your cycle helmets as well. And that's just only one example. So there is a really, really close connection between the home itself, the light, you know, the kind of space that you have, as well as, you know, your doorstep and then the wider settlement. Studies have shown that actually the decision and to encourage people to walk and cycle, for example, very much more depends on actually where you're starting your journey than where you're finishing it. So I think that's quite important to consider in the work we do in terms of the wider strategies as well. So next slide, please. So the first one I wanted to mention, and it's one of the case studies, is Northstowe, which is the new town. And we started working with Homes England probably 5-6 years ago now on phases 2 and 3. And at that time, Northstowe just became a healthy new town, and we were commissioned to write the design code for phase 2. And the priorities that were set out are kind of listed on the slide. So it's very much creating an environment that nudges people to adopt healthier lifestyles, and that can make a positive contribution. And that is kind of almost removing as many barriers as possible for people to live healthily. And that is very much looking at the community across all ages and abilities. And when we set out this on this project, it was, you know, so as master planners, you make the connections, you integrate walking, cycling, open space. So a lot of the big ticket items, but actually going into this and really focusing on it, and also working with Cambridge University at the time, opened eyes a bit to a lot of the smaller elements and the smaller details, and really allowed us to focus on the healthy living and healthy homes in a different way, in a much more focused and intense way, which we can now take into other projects. Next slide, please. So, I mean, I've just taken a snapshot of the content, for example, of the design code. And I mean, looking at just a simple heading of mental health, because all the health issues are interlinked, you can see actually how many of the coding topics do relate to mental health. For example, you know, designing a good public realm is really important so that people are not scared and can get around and feel safe. That you have interesting streets to walk along, eyes on the street, that you have the right landscape, right lighting strategy. So all of these elements are kind of directly or indirectly linked to the mental health of the community. And I think that is what Northstowe enabled us to do, to really focus and on those different health outcomes and health measures through the design of the wider place as well as the home. Next one. So just a kind of summary, really, because there are lots of different elements in there, but what we kind of looked at in particular, and, you know, just establishing a couple of simple rules, and, for example, to have a network of quiet streets, a network of safe cycle routes every 250 meters. And the 250 meters has kind of come from Holland and studies there. Because as we were developing this, we found that there are a lot of incredible good research and studies. But actually turning that into measurable design criteria wasn't always kind of straightforward. But I think it's also considering, as I said, all abilities. So again, cycling, you know, we have people who are really confident, want to go really fast. We have others that are learning. So I think it's accommodating the different range of people, the different abilities, so that everybody is kind of has the confidence to go out. Public open space within 300 meters. I mean, that's quite a common kind of planning requirement nowadays. And also looking at play, not just thinking about children, but actually thinking about all ages and what play and being joyful in our environment actually means for them. And one element that came out of there is that the really small elements that are absolutely essential, but actually can be quite difficult to deliver. And that is drinking fountains, for example, because, you know, the elderly and also people with health issues, it's often that they get dehydrated, or actually kind of public toilets. again, it's kind of a confidence issue for often the elderly population as well, who don't dare go out of the house or kind of venture far away, as well as the seating opportunities. So all those elements kind of really kind of were embedded within the code. And so from the strategic to the detail. And I think it is sometimes easy, I guess, to focus on the big picture and actually forget the little elements, especially when you're working on bigger schemes. Next one, please. So I think some of the key, oh, sorry, one of the documents has kind of twisted itself. Apologies, not entirely sure what happened there. But North Star and the Healthy Town Principles are really governed by two documents. One is the design code, and then there's particular healthy living, youth and play strategy, which identifies direct health measures that are embedded within the future design codes now and also within the requirements for the developers. And I think what these documents and what North Star was trying to do is to kind of get, allow behavior change, allow people to make positive choices. So it's not about forcing people one way or the other, but actually kind of encouraging other behaviors. And that is linking it back to the home is about, for example, having a front garden where your bicycle is parked and having the storage within the house, so that you can kind of choose the active travel versus the car. And I think it's really important that, the big picture, the strategic elements matter as much as the detail. And I don't know if any one of you has recently heard somebody from Amersfoort speaking, and he was talking about the big developments, but also the detail. And he was talking about how they required every window ledge on the outside to be 30 centimeters wide, so that people can put their coffee cup on it on the ground floor while they're chatting to their neighbors. So sometimes it's very simple things that can actually encourage a different behavior. Next slide, please. The other example I want to mention is the Bradford District Design Code, as well as a design guide, which we have been working on before. Next slide. So Bradford Council was always clear that there are a lot of issues. It is a large, fast-growing district. It has a lot of younger population, there are a lot of health issues, and the kind of disparities across the district are wide and need to be addressed. And it's a very diverse district as well. And in the new local plan, they're looking to kind of densify and build a lot of new urban homes. And so therefore they realized they needed a code and take the existing homes and neighborhoods guides forward into a kind of design code. Next, please. So these are this is the vision for the design guide, which was adopted, I think it's probably 5-6 years ago. And in that, and in the brief at the time, it was very clear that they wanted to address the childhood illness that existed, child obesity, poverty, and that's really something they wanted to focus on. And at the time, we worked with them to prepare this guide, which is, again, every aspect of it, every vision element has been tested and looked at from the particular lens of health and well-being. Next one, please. And some of you might recognize these sketches. We had the pleasure of working with Rob Cowan, who developed the kind of the community that is embedded within the code, within the guide at the time. And in our recent engagement, what we actually heard, and I thought I kind of raised some of the things we've heard from the community. It is that new homes should be easier and cheaper to heat. I mean, that was very much at the time the topic, increasing gas prices, heating prices, and so on. But that streets were very important, again, as people step out of their house, encourage people to come out of the houses and encourage healthier lifestyles, particularly safe for children to walk and cycle. So it was quite interesting to hear some of these comments. I mean, a lot of comments actually also had to do with things that couldn't necessarily be controlled through planning policy, like a guide or code. They had to do with noise insulation, storage was a big subject. And I mean, others you can expect about kind of light and air and spaces in the homes. Next one, please. So we embarked with the councillors on a journey to take the existing guide and kind of turn that into code, and not just turn everything into code, but actually code the elements where the officers found certain weaknesses in terms of delivering the positive outcomes they were expecting. So the guide is very much built around the principles of a neighborhood, the context, the streets and the spaces, but then also kind of the home. So, and that's about principles around outdoor space, light, ventilation, storage. But they were principles, not code. And Bradford was one of the first Pathfinder codes as well, and it was very much about having something measurable, so translating principles into measurable outcomes. So the code talks about minimizing single aspect dwellings, outdoor space, semi-private communal space, because that was a particular focus, because the community also told us when we asked them what would a good flat look like, it was very much about space where the residents of that apartment block could meet. So it wasn't just about everybody being in their own flats, but actually having that communal space was very, very important for them. Next one, please. And I'm going to rush through these because we want time for discussion. Just a couple of examples, in particular, how it could address, sense of safety, anxiety, loneliness, inactivity. And that is about the communal entrances. It is about the communal circulation space where people can come together, where you can bump into your neighbors and have a conversation, talk to each other, get to know each other. This is particularly important also with the lens of the kind of, elderly population. Then it's about the safety, feeling safe on the street, as well as you come home and leave the house. About the ground floor, the flats, the lighting, those elements, absolutely critical. And next one. And it is about, if anyone has ever been to Bradford and that area, it's quite hilly. So really looking also to making sure that people feel safe and can walk around. So it's about resting places, and so having more resting places when streets are kind of on a steep gradient, having handrails where we need them. So really taking a lot of the lessons that we have learned over the years from inside the house also into our environments. So you're not just safe when you're kind of taking a shower, but you're actually safe when you're going to the local shops as well. And again, particular relevant for the elderly population, and ensure that they're not forced to stay indoors and be lonely, but actually can venture out and be part of an active community. And next one, and I think that's the last. So, and this is about play, very much about the space in and around the home, the communal space as well. And having the doorstop play, or, it can be simple locks, it can be a swing, it can be kind of painted tarmac, but really kind of looking at what do the homes need to provide, either each house or communally, so that we can create that healthier community and actually health within the home, as well as on your doorstep and also in the wider environment. So at this point, I hand back to Rosalie. Thank you very much.
Thanks, Katya. I wonder if I could invite all the presenters to pop your cameras on. And just to say, what I loved about your presentation, Katya, was about, this reminder that the tendency of the conversation around housing is just to focus on the home. And what we've been really keen to do is make sure that we make that link between not just housing quality, but how the housing links to the wider community and all of that. So I think that's what's really exciting about your approach and how you've been working in Bradford and so on. So we've been trying to answer some of the questions as we've been going along. So do have a look at some of the answered questions in the Q&A part. And because we've only got a limited time left, I think we're going to just deal with perhaps a couple of questions. One of the audiences asked about this question of viability, and I think we hear it quite a lot. If we push up the standards beyond the bare minimum building regulations, it's going to cost more. I know from TCPA's point of view, we would say, well, maybe upfront in the short term, there is an additional sort of capital cost, but actually in the long term, we're thinking about, all the cost savings you make from creating a healthy, good quality place. And actually that has real benefits, both financially as well as socially and environmentally. But I wonder if any of the panelists would like to sort of respond to that criticism about pushing for higher standards, particularly in relation to affordable housing provision. Katya, thanks.
Yeah, I mean, it's a very kind of, well, it's a critical issue. And I mean, there's been a lot of discussion on the design code, for example. If you raise standards, require more space, then what does that do to the viability? And I mean, certainly, there is an affordability threshold. In order to test these requirements, we have undertaken an assessment about those coding requirements that cost more, but those coding requirements that also increase the value of the property or the space. So because they go hand in hand. And we thought it was reasonable to ask for higher coding requirements or additional requirements where it also increases the value. Where things were where it was just more costly but didn't increase the value, that's where we were kind of looking at it again. So, because I think cost and value has been, you have to look at it together, you can't separate them. And I think that's where we had the conversation with the developers then about really teasing out the value and cost kind of scenarios for the different requirements.
Thanks, Katya. Emily, did you want to respond to that?
I was just going to respond really, really briefly, just to say there isn't always that kind of either or trade-off. Sometimes good design is also doesn't always cost more. Some of it's about embedding principles. Obviously, some aspects do. There is another really key point that I think sometimes gets overlooked, which is actually the running cost of having a dwelling which has high, insulation sustainability standards. Potentially, those kind of sustainable angles can also save a lot of money to tenants. And I think sometimes we've been working towards an approach which Nathan's been kind of developing, where we perhaps can think about not just the cost of a rent, but also looking at the rent and running costs together, because it could be, it's just as important, particularly with energy bills so high at the minute, people are really, really struggling. That side of things is important. So I think it's just really important we don't just think about immediate costs, but also look at running costs for buildings whenever we have that conversation.
Emily, I see that you wanted to respond to a question about space standards, and I think it's an interesting one because weirdly, under permitted development rights, they have to meet nationally described space standards. It's not required for new builds outside of that, so it's sort of up to local authorities to have quite strong local plan policies on that area. So it'd be interesting to hear your comments on that.
I mean, I think that comes into this territory. I sometimes describe the planning system as a kind of national system disguised as local accountability, where we get, a lot of blame without a lot of control. But I was just going to flag that that was quite helpful for us, adopting the healthy home principles as a handle for asking for better space standards. So our local plan is very much draft at the minute, but in the most recent consultation, the bit of policy that we consulted on was the plan will set out policy. So this is at the very front and centre. It's also in Healthy Homes is then embedded throughout the housing bit, but at the very front and under the aims, it's the plan will set out the policies that will help to determine where planning applications that include residential development meet the needs of the district. The policies propose to ensure that new homes include sufficient indoor and outdoor space, and that new housing developments respond to the needs of the different size households and different income levels that are expected from existing and future residents over the plan period, in accordance with the Healthy Homes principles. So for us, that was a way the Healthy Homes principles helped us to package that aspiration up.
Thanks, that's really interesting. I think one of the key messages we wanted to make through this guide is that these principles are quite high level, so that they can be interpreted and applied in a local context and made relevant to that local context. So it's really great to hear that it was useful in that context for you. Jennifer, did you want to respond to that? Thanks.
Yeah, sorry, I was just going to respond to in agreement with both Katya and Emily's points on viability. We're certainly seeing similar there too. But I just wanted to, I guess, re-emphasize that the point we were making earlier about the cost of not doing, and increasingly from an HQM perspective, we're seeing investor interest in the risk of not building developments that are resilient, both in terms of place, but in terms of use and meeting that occupier need as well. So, agree with everything that Emily and Katya said as well, but also just considering the cost of not embedding and that future proofing ability as well.
Thanks. In the chat, there's or Q&A, there's a sort of related question about enabling officers to kind of enforce or encourage requirements, and being afraid to challenge developers, for the risk of legal challenge. And I didn't know if Lewes District Council had any kind of thoughts on that particular question. One of the things that the TCPA have done recently is we wrote a sort of fact checker on some of the kind of pushback we get from certain sectors of the developer community, around quality and increasing quality requirements, and it's slowing down, rates of delivery and things. But actually, the evidence sort of would suggest otherwise, and also being aware that there's an increasing interest from institutional investors in environmental, social and governance requirements around real estate and residential developments. And when you've got that increased demand coming from the financial industry, I think that's a good motivator for developers in this area. But I don't know if you had any thoughts about the legal challenge.
Yeah, I mean, I think planning is a really difficult place at the minute. I think everyone's planning departments are so stretched. We have been quite strong with developers. We're seeing a lot of stuff at appeal, which is then very expensive and time consuming and adds to our problems. So I don't think we can underestimate the challenges that are there. They're really, really intense. Having said that, I think our planners have had confidence because of the fact that we've formally adopted some of these principles. So we've formally adopted as a council the principles, but we've also looked to make this part of planning policy. It's also how we approach, there was a question in the chat about existing homes as well. And obviously that's really important as well, as that's very challenging too, with kind of budgets and the lack of powers. We're not allowed to set our own council house rents at the minute. So we couldn't choose to spend some money that would then save money on bills because there's a cap there. I suppose, in terms of how do we get our officers to do it, obviously I'd say get them to talk to Nathan, because he's done an amazing job, and I think our officers have been brilliant on it. But as from a council perspective, that's what I'd say. I don't know if Nathan wanted to add anything to that.
Yeah, no, I think that's right. I mean, I think there's something about by setting it strategically in policy and strategy that filters down to the officers. It gives the officers some confidence in what they're saying back to developers. But to your point, we're not expecting that those challenges to go away. We know that those issues will continue to arise, but our planners are being strong in it. I think we're still going through our local plan process as well, Emily, aren't we? So, you know, let's see where we end up. But so far, we are pushing quite strongly on the developers, as you say.
I'm conscious that we've hit our 1 hour allotted time, so I don't want to cut into people's lunch breaks, but we could just go to the final slide, Clement. I just want to thank very much all the panelists for joining us today, and it's just really positive to see, you know, the opportunities that there are to embed health within our house building and also wider placemaking. So yeah, just thanks for today, and please do stay in touch with us on the campaign for healthy homes. And if you've got any further questions, I'm sorry we weren't able to cover them all today, but do get in touch with us, and we will try and respond to as many as we can. Thanks again.
Thank you.
Thanks, Katja.
Thank you. Bye.
See you soon. Bye.